The whole notion of food, the food is who we are. Food is, in every culture, has a lot of a connotation with regards to where do I fit in society, where am I part of, where am I with regards to people I care about and my society. Food can be love, food can be approbation, and food can be very negative. If we focus on sort of a negative context of food, then you almost set up individuals to fail, because we're always going to have to eat. We're always going to have to nourish ourselves on a daily basis. We may not always need medication, but we're always going to need to eat. So if we have a condition that is chronic and progressive and is at some level a metabolic process of excessive calories, or the improper, or the inappropriate use of the glucose that we absorb from our food and how it's handled, if essentially that is an ongoing problem and food has a social connotation to it, we have to embrace food as part of the care cycle. You eat. It's not that you made a mistake, or you should be, you ruined your chances of improvement because you had an extra portion of food at some point. That, from a human standpoint, from an anthropological standpoint, that's a doomed to fail paradigm, because food then is used as almost as a weapon, and it's a self-flagellation. Oh, I ate that, or I shouldn't have done that. We have to move away from that, because the negativity of an approach to lifestyle management, I don't think ever works. I think people have to feel, I'm doing something because my goal is being achieved in some form or fashion. And it may be that they don't feel any different with lifestyle management, in that they didn't feel sick in the first place, but they're able to objectively understand that their modification over a period of time led to objective improvements. So the concept of the balanced scorecard, the cross-disciplinary scorecard, allows them to understand, am I on the right track, or am I actually going in the direction I don't want to go in? So that if they do have periods of time where maybe they're not following exactly the plan for nutrition that they should, or that they agreed to, that is not necessarily a terrible thing. It is part of life, and it's part of being human, and that has to be factored into the long-term approach. And I think it's an example of how we need to move away from disease and into health, that eating is important, and it shouldn't be a bad thing. It should be a good thing.